and we're really hoping to see you at more of these meetings. I think that would be fantastic. And I share with you also, Dr. Jones has done a fantastic job in terms of webcasting this so that people around the country who possibly are housebound can actually sort of participate and hear what's going on. And I think that's really due to credit to Dr. Jones. One thing that Dr. Jones mentioned in her initial introduction to you had to do with the recommendations that we have been making. And one question that I know our research subcommittee has periodically brought up is kind of what is the current mechanism for recommendations from this committee going to the Secretary? We've heard kind of mixed issues concerning whether there's mechanisms in place. If there aren't mechanisms in place, can you help us understand kind of why they're not? And if there are new mechanisms in place, can you help elucidate that so that we have a clearer idea as to all the work that we've done and how that gets translated to the Secretary in terms of actions or not actions concerning those recommendations? Thank you.
Well, we have some 150 advisory committees to the Secretary, and the committees are generally of outstanding caliber, and they all produce reports on a regular basis, and they all get sent up to the Secretary's office, and they all do get reviewed, so I can assure you that. I think what has not happened, which we need to improve, is the direct communication back to you, and also especially direct face-to-face communication back to you about which of these recommendations can be actionable immediately and which would perhaps need more time. I think too often you and your colleagues have worked hard and then sent up the recommendations not knowing whether anybody is actually looking at these and getting back to you in a face-to-face fashion. So I'm going to make the commitment to do that for you. I also obviously see the Secretary on a regular basis and report to her about the 9, actually soon going to become 10 advisory committees that I directly oversee on behalf of the Secretary and the President. So please keep working with us, and thank you for your patience. I think what I can do for you is give you more direct face-to-face feedback and communication about what we can do together moving forward.
Nancy, and then
you'll see it repeated over and over in the recommendations, but it underscores how important it is. Only 15% of this population has been diagnosed, that there's such an extraordinary lack of knowledge on the part of healthcare providers and access to knowledgeable healthcare providers, that the end result at the patient level is tremendous suffering. It's a terrible thing to think that 85% of these patients out there haven't even obtained a diagnosis. That's a critical issue, and so there's over and over and over again in the recommendations themes that are aimed at establishing regional centers, putting expert people together, and then morphing that into a clinical research, team building kind of effort that could result in increasing the momentum that we need to have to offer effective therapies or studies that would result in effective therapies or changes in or even establishing, let's just start right there, establishing clinical guidelines so that physicians and other healthcare providers can approach this population appropriately. And if I could just underscore, if there's one thing this committee could achieve, if it could achieve that, it would have achieved a tremendous thing for the patients.
Those are important points. I do want to stress and thank my colleagues to the other federal agencies who are here. I know many of my colleagues from the other federal agencies have been working on this issue and serving on this committee for many, many years. And so the fact that you have at least a half a dozen agencies, Wanda, represented here, I think is a sign of that commitment. And actually, Dr. Jones and I also did have a direct discussion with Dr. Francis Collins, the new NIH director, about this issue last month in my office. So we can coordinate some of the HHS and federal government issues with you and try to promote some of the suggestions that you just summarized, which I think sounds so reasonable. So let's keep the communication going.
One of the questions we have had is what kinds of what kinds of recommendations are most useful to you? Is it fairly open-ended? Is it anything that we believe would be helpful to the chronic fatigue community, or is it something that you're more likely to use if it's targeted in certain directions, and if so, what would those directions be?
I think addressing the need is where we have to start with any public health issue, so please keep doing that. And then, obviously, in these tough economic times, if it's a recommendation that comes without a big request for resources, that's sometimes easier to push along faster. But start with the need. Please keep focusing on that, because we want to be helpful to you.
And it should be pretty open-ended. Anything that we believe can help the chronic fatigue syndrome
Absolutely.
community.
Yeah. I mean, there's so many issues here, which you know better than I do. We need to start making a difference. So, please keep focusing on the need. That's what we do in public health.
Any further questions? I just want to make a quick comment. I'm really pleased that you're here today, Dr. Coe. I think a key thing for this committee is to get feedback on the job that we're doing, and that'll enable us better to facilitate, moving the case for chronic fatigue syndrome forward. So anything you can do in that respect will be greatly appreciated.
So please continue. I'll stay just a little while longer, but thank you again for all your work. I applaud you for your service to the country. Thank you. Thank you.